Today, we're excited to bring you the post-event details and recap of the workshop, Elevating Aesthetics, Exploring the World of Design. This immersive event, held on 22nd of May 2023, was a captivating journey into the realm of design, aesthetics, and creative inspiration for plastic surgery. Dr. Garth Fisher is a true icon in the world of plastic surgery, with over 3 decades of expertise. Renowned for his exceptional artistry, precision, and dedication to perfection, Dr. Fisher's exceptional talent has garnered the attention and trust of high-profile clientele, including the Kardashian family. His work with celebrities like Kim Kardashian, Khloe Kardashian, and Kris Jenner has made him a go-to choice for those seeking red carpet-worthy transformations. From renowned actors and musicians to influential personalities.
Hello, Dr. Mayor.
Hi, good evening from Dubai. How's everything?
Welcome, everyone. Welcome. We are welcoming MediPocket for another workshop, another successful workshop, especially with Dr. Fisher. Welcome, Dr. Fisher from Dubai. And
thank you.
I would like to welcome everyone for this extraordinary and exclusive session featuring one of the world's most renowned, not only just Los Angeles, but world most renowned plastic surgeon, recipient of prestigious awards, Dr. Garth Fisher. At MediPocket USA, we are bringing the world's best American healthcare to patients around the world, international patients from over 52 countries, including UAE, India, Singapore, and many more, with the finest specialists and hospitals in the United States for virtual second opinion and treatment in the United States. We organize these workshops with our esteemed partner, Balouch Royal Investment Dubai, to provide a platform for international patients, doctors, hospitals, and organizations to meet and interact with renowned specialists from the United States. I'm truly humbled and honored to have with us today one of the masters of plastic surgery, Dr. Garth Fisher. We'll go a little brief intro about him because Dr. Fisher's bio is really detailed, full of exciting and great work, but I'll give a little glimpse. So Dr. Fisher is internationally recognized, and he stands as one of the foremost plastic surgeons globally with his Beverly Hills office offering service as the epitome of excellence in cosmetic and reconstructive surgery. Dr. Fisher's contribution to the field of plastic surgery are unparalleled. He's the visionary behind the iconic television series Extreme Makeover, which captivated audiences worldwide. His revolutionary techniques have transformed aesthetic, cosmetic plastic surgery for the face, nose, breast, and body, earning him the esteemed title of one of the world's best facial plastic surgeons. His clientele includes A-list celebrities from Kardashians to fashion icons, Fortune 500 executives, and distinguished individuals from around the world who value his surgical mastery and clinical judgment. He has consistently been listed as one of the top plastic surgeons in the United States for facial, cosmetic, and breast surgery in the esteemed publications such as Best Doctors of America. He holds coveted position of America's Top Doctors, a recognition bestowed upon less than 1% of nation's physicians. USA Today and Los Angeles magazine have also recognized him as #1 plastic surgeon in the United States and Los Angeles. Dr. Fisher's commitment to patient education is unwavering, and his award-winning informational DVD, The Naked Truth About Plastic Surgery and The Naked Truth About Anesthesia, empowers individuals with comprehensive knowledge about plastic surgery, procedure risk and rewards. As an esteemed educator, Dr. Fisher shares his expertise internationally, refining surgical techniques and elevating standards of plastic surgery. Please join me in giving a warm welcome to Dr. Fisher, the master of rejuvenation and reconstruction. Sir, we are truly privileged to have you, Dr. Fisher, here. If we could kindly share a few words of yourself and your remarkable work with us, please.
Oh, thank you very much. That was a very warm and kind welcome, generous welcome. I'm happy to be here. Actually just got back from Dubai and Saudi Arabia and Abu Dhabi about a week ago. I was there for 2 weeks, but I'm very pleased to be on this show with you guys on this presentation. I'm a Beverly Hills plastic surgeon. I've been in practice since 1991 in Beverly Hills. I've got a thriving practice, mainly a lot of out of town, out of country patients, and we're just very blessed with a great staff here. A lot of people asked me about the Extreme Makeover Show, which was kind of a monumental thing that happened in plastic surgery, cosmetic surgery, and that's actually cosmetic dentistry back around 2004, 2005. I see the Kardashians on my screen now, which I love them. They're like very, very good friends of mine, and I've been on their show quite a bit. So at any rate, this guy, Howard Schultz, came to my office one time and he said, I'm trying to do this makeover show where we have somebody that becomes a Cinderella for a day. She or he, actually are, come from very, very humble beginnings and don't have any money and they couldn't do this for themselves, but we want to, make their plastic surgery where they're beautiful or handsome, whatever, get their teeth done with veneers and their whole mouth reconstructed. If they need eye surgery so they can see better, like LASIK, and their hair and makeup done, I think this is going to be an amazing show. And up to that point, there'd never been a plastic surgery show on TV. So, I mean, I looked at him and I thought, gosh, I don't know about this. My waiting list is a year and I don't want to ruin my practice by doing this show. And I said, Howard, I don't think I'm going to do this. I appreciate it though. So he really wanted me to do it. He left. And about 2 weeks later, he came back. I said, what's going on? He says, well, we've been around the country just interviewing doctors, and I just want you to be the doctor. I want you to be the one on this show. And I started talking to him. I trusted him. I thought that maybe this was going to be something that was going to be a really productive and professionally done show. I had some content control. And I said, well, okay, I trust you as long as we're not, just taking advantage of patients. It's got to be done in a very professional way. And that's kind of how Extreme Makeover launched. The first night, I think there was 24 million viewers, and we would take these women and men and just, they would never be able to afford this, and just give them the most amazing experience during the day, during the days that they had procedures, whether it was veneers or they had plastic surgery procedures. And it was just such a really great show. At the end of each show, you're so happy and you're actually crying for these patients. And I thought it was done very professionally. It really raised the plastic surgery IQ of patients, and it brought plastic surgery out of the mystery as the first show on TV regarding plastic surgery, and it was running in 150 countries. I was very proud of this, how it turned out. And you can still probably go back and see some of the segments. I know I have some of them on my Instagram and also some of them on my website. I'm not a big Instagram guy at all. I just, my daughters actually told me, you've got to start one. I said, I don't know. But I've got one. It's Garth Fisher, MD, but it's very, it's not kept up too well. But my main thing is my website, which is www.garthfisher.com. And you can see some of the Extreme Makeover shows, I think, there. But at any rate, this entire show had a ripple effect through the cosmetic industry. And the next year, there were 30% more plastic surgery procedures performed in the world, as well as cosmetic dentistry procedures, to show you the profound impact that this had. And it also rippled through the cosmetic industry, which really raised the tide for everybody. I was very proud of that. I think that's probably been my biggest contribution, which has affected plastic surgery, cosmetic dentistry, as well as just the cosmetic industry. But again, it was just a fantastic show. So I love those situations where we have patients, we still see them. Sometimes I take cases like that and I just do them without charging patients, because it touches my heart and it's enjoyable for me. But I just really love what I do. I love surgery. I couldn't see myself not doing surgery because it's just such an enjoyable, it's an enjoyable experience for me. And the most important thing is taking a patient, and then when they're done, they're happy, and you feel like you've contributed something to their life where it makes them feel better about themselves. And my entire staff loves that. I love that.
Amazing. I mean, Extreme Makeover, I think, was a sensational show. I think that was brought at that time because, as you rightly said, plastic surgery seemed very far for most of the people. But you really brought it to mainstream. And I think most of us have watched that show. If not, I would recommend everyone joining from around the world. It is still available, I think, on a few platforms. Still, they have the recordings. I don't know. I think Netflix have it. But yeah, do watch this show. Amazing. So I think while our audiences are putting their question, I have one question from my side as from a medical thing. Like, I mean, you could have joined any medical profession, I would say, any specialty, and would have done wonders, right? Well, what inspired you to pursue a career in plastic surgery and becoming a leading expert in it?
Well, I also always had an artistic eye. I was very creative and artistic eye. In fact, I'll tell you another story. I eventually chose between trauma surgery and cardiac surgery. I love trauma surgery because there's so much action. You know, I really love that. But when I was in my residency, I saw that this was happening 2 or 3 in the morning every night. You know, when the bar's let out or somebody's out running their car, you know, going too fast because they're drinking. And I wanted to have a family life, so I really didn't want to live in the hospital at 3 in the morning every morning. And I loved heart surgery, but you know, a lot of people died during that. And you know, the thing with plastic surgery is it's so creative, and you have room. And I think I have a very good understanding of beauty. So you know, to be a plastic surgeon, you can't just be, you know, smart and, you know, pass all the tests. What's different about plastic surgery is you have to have some artistic sensibility where things that look good to you look good to most other people. You have to have that appreciation. And I really enjoy patients. I enjoy the patient interaction. So that's one of the reasons why I got into plastic surgery, was just making that decision. And I was very fortunate. The chairman of the plastic surgery program came up to me one day. I was in the 4th year of general surgery residency. It's a 5-year general surgery residency, and then you go into plastic surgery. And he just walked up to me in a hall and he said, "Do you want a plastic surgery spot? You know, there's 2 people, probably 300 people applying, and I won't even, you don't have to apply. I want you to be a plastic surgery resident with us." And I said, "Yes, that's hard to turn that down." So I took the advantage of that. But you know, an interesting story is I was when I was younger, my father was a prisoner of war and never came back from a war from the United States in Vietnam. And so we didn't have any money at all. And I was going to college and I was going to be an architect. And I had a lot of different jobs as a child because I was supporting myself and my family. One of the jobs happened to be a janitor. And I was dating the janitors. There's the head surgeon of that hospital. My first year in college, the head surgeon of that hospital was the father of the girl I was dating. He was quite embarrassed that his daughter was dating a janitor. But at any rate, he knew I made great grades, and he came out in the hall one day. He said, "Garth, come in and watch me do this operation." And I put down my mop, went in and watched the operation. I said, "You know what? I'm going to be a surgeon. I'm going to go into surgery." And it changed my life. It was one of the best experiences I ever had. And I think that exposure is just so important for people, young kids growing up, you know, so they can see what they want to be and, you know, strive for something and have inspiration and aspirations. So that was kind of a turning point in my life. But then you asked me why I want to be a plastic surgeon. It's generally because of the reasons I also elucidated on.
Wow, that's so inspiring. I think beside your expertise, I think your journey is very inspiring. How from a very humble, you really reached to the top of the world where, you know, you are taken as an example by not just the young, I think even the professionals who are quite advanced in the career still take you as their reference and example. So
thank you very much.
Yeah. Musab, if we have any questions, we can do from the audience, or I have some questions in advance that audience gave. So
let's start with the questions you have, and then I will collect the questions from our current audience and share it with you.
Okay, we do have a time restriction with Dr. Fisher, so we'll try to, because I promised him that we won't take a lot of time. One of the questions which is asked by the audience as we collected in advance was, what are the common misconceptions or myths about plastic surgery that you would like to debunk?
Well, I guess one of the myths, a lot of people, well, first of all, we don't use plastic. That comes from a Greek word, plastikos. That's one of the myths. There's no plastic. Well, a lot of patients come in and they want to look like somebody else. And you can bring those features to us and let us look at those, so it points us in that direction. But I mean, obviously, if I could make somebody look like Brad Pitt, I'd just become a movie agent. I'd make 20 Brad Pitts or George Clooney's or whatever. So that's one of the myths. I think that people's when you find a doctor, you should find somebody who's very, very honest and is going to tell you the right expectations, really ground you so you understand what you're going to get, what you're not going to get. From my approach is, I want my patients to be happy, and they're going to be happy if I tell them the truth and I do a good job. It's really simple. So if I don't carry out my part of the deal, then it's not going to be good for anybody. So I think you just have to be aware and listen as the doctor tells you. They got to tell you the risks, benefits, and alternatives of anything that you're doing. That's probably what I would say.
Yeah, the best one. Yeah, as you said, there's no plastic in plastic surgery. I think people think it's all about being superficial and all. It's not. It's a various factors. As we are in the month of May, which is a mental health month, celebrated around the world, have a question around it. In your experience, what role does mental and emotional well-being play in the success of plastic surgery procedures?
Well, you obviously want to operate on somebody who's not only healthy, but also mentally healthy. And it takes time to kind of determine where a patient's at with that. I'm very careful who I select. I probably turn down 30-40% of the patients that come to the office for various reasons, but mental health is also one of them. I don't like operating on somebody in the middle of an emotional turmoil. Like, the problem is a lot of people are getting divorces and they think the women think it's because of them when it's not. And maybe they think they're not pretty enough. And I try not to get in the middle of that because, it's easy to take advantage of somebody like that, but it's just not the right time. They're going through too much. And so, people ask me, how do they get addicted to plastic surgery? Well, it depends. I mean, sometimes the patient will come in, they'll have a great result. So then they want to do something else and they have a great result. They want to do something else, which is not really addictive. I see that if it's a person who can improve these particular areas and they're assessed honestly by the surgeon and they do a good job, then I don't know if it's an addiction. I think it's just they're getting good results. Then you look at somebody like Michael Jackson, and he kept having nose surgeries, and I wouldn't say he was addicted to it. He had a really bad problem that he wanted fixed, and I would understand that. I would want it fixed too. And so he kept going back and forth to doctors to try to get it fixed. It just got worse. And it's the doctor's responsibility at that point. It's the doctor's responsibility to say, no, you can't do this. But some people take advantage of the patients, and that happens. So then you've got, other patients that mentally are not healthy enough to have surgery, and they have body dysmorphia, or they don't look at themselves the way that they should. And I'm just very honest with them. I say, look, you're great. You don't need anything. Please don't do this. You're going to find yourself, sliding down the hill and not getting where you want to get. So, all this is a doctor's responsibility to say no. It's really simple, I think.
Yeah, and I think this practice should be across industry would be helpful, because as you rightly said, sometimes they are taking advantage of the situation, and that's a little sad. But a question from the audience, which is and it's a two combined questions. What advice would you give to individuals considering plastic surgery for the first time, and how do they approach patient consultation and ensure that their expectations are aligned and realistic outcomes?
It's a great question and a very important one. I think that patients having a first consultation or considering plastic surgery for the first time should, it's good to hear from a friend who's had a very good experience. Okay. That's one person that's, and you like, and you can count on. And then you look at the doctor's pictures to see if that's a reflection of the philosophy or the artistic sensibility that you would think that you might like for yourself, because that reflects his work or her work. So I think those two things. Then three, I think you need to go in multiple consultations. Go to a lot of people, or 3 doctors or 4 doctors, and then find the one that you feel the most comfortable with. I can tell you that board certification, this is very important. A board certification, tells the patient that the doctor's had all the training that he needed to, graduate and become board certified in that specialty. The problem is for doctors, particularly plastic surgery more than anything, is, again, we can pass tests. We're all smart. We all went to medical school. We all got board certified. But in plastic surgery, you have to have an artistic component to what you do, which is not measurable in any way. So you could give 10 plastic surgeons the best paint brushes and paper in the world, and you get 10 different drawings or paintings. 2 would be masterpieces, maybe 2 would be cartoons, and you got another 6 that, okay. So that's the really difficult part with plastic surgery, that as opposed to other specialties.
Very well said. And that actually aligns what at MediPocket we are doing is the second opinion. As you said, you should not just take from one, but at least 2 or 3, which is like before you go for any major procedure, go for second opinion, third
Yes,
opinion
I
even
agree. Yes.
for that sense. So Musab, do we have any from the live audience? Because I have the one
Yes,
that
I have a question. Yeah, I want to ask, if I go for a plastic surgery for a face, like for lips or for eyebrows or anything, can I reverse it, especially for the lips?
Some things you can reverse, some things you can't, but you can't go into a procedure planning on reversing it, because that's indeed hard. I mean, sometimes you put filler in, you can dissolve them, that's fine. But, you know, sometimes you do fat grafting and it's unpredictable how much it's going to take. Some takes, some doesn't, and then you're left with that. So, you know, and obviously if you do a tummy tuck, you excise skin, you can't reverse that. So there's things that you can reverse maybe, and there's things you can't, but I don't think that's the attitude. You got to be sure before you go in, be aware of the risks and benefits of what you're doing, and make sure that it's indicated. It's not the doctor trying to make money, or the, you know, you have to find out, you know, you have to be, I think, prepared for, you know, not reversing something.
Thank you. Thank you.
Yes, Chris, go ahead.
Okay, thank you very much, Musab. And thank you, Dr. Fisher, for joining us today. So my question is, have you ever in your experience had to deal with a point where you didn't want to continue this career path? Because I know there are certain problems with relating to plastic surgery. You know, sometimes you have to deal with difficult patients and all. Have you ever had that kind of encounter in your life that you wanted to quit or try something new?
You asked if I wanted to quit plastic surgery?
Yeah,
Oh,
ever.
never. I love this. I mean, if somebody gave me $10 billion, I'd still operate. I love the patients I get to see. Who else? I mean, I've got the gateway to the world coming through my office, and I just love meeting the people. I love operating. I love I just, you know, it's like sculpting to me. It's very therapeutic. The easiest part of my day is operating. So I love that. I've got you know, I don't really have any emergencies with what I do. You know, I love difficult patients that are not difficult patients. Actually, I don't like difficult patients. You know, some people we just aren't friends with, and I like people that are my practice to be my friends, as far as, you know, I get along with them and everything else. But I like difficult, complex problems. I love doing that. You know, we get sent extremely complicated stuff, which is challenging, and I enjoy that. So, but I've never once thought I'm going to stop plastic surgery. I look forward to getting up and coming to work.
Oh, that's amazing.
Yeah.
And I was watching a YouTube video where the guy asked you how it all started, and you said something about you being I think with someone, and then you looked at the father performing surgery, and then it all started from there.
Starting my plastic surgery. Well, yeah, there's a guy I trained with, Bruce Cannell, who was the best facelift surgeon that ever lived. And, you know, once I saw, I've done many facelifts and trained with other people. But once I saw his results, I said, gosh, this is exactly what I want to do. It was clearly the best work I've ever seen in my entire life. So I spent 6 months training with him, and I was doing really a lot of facelift surgery. And enjoying my practice. And I got kind of the Oprah call in 1994. You know, Hugh Hefner contacted me and asked me if I did this girl's breast. I said, yes. He said, those are the best ones I've ever seen. And, you know, the Playboy Mansion started sending me all the breast cases, and you know, it was like an avalanche coming. And so that was another high point of my life with breast surgery. So we've done thousands and tens of thousands of those breast surgery since then. You know, with all the Playboy girls and everything. And it's just a kind of, you know, I just have been very fortunate and blessed, and I enjoy my work, and I'm happy with things, how they turned out, and just very fortunate, I feel.
That's great. Impressive. Thank you very much.
Thank you.
Dr. Fisher, I have two more questions, and then I know your time is restricted with us. So can you share, I think you shared a lot of stories with us, but any particular story where of a patient where the experience going through the procedure with you significantly boosted their self-confidence and well-being after the surgery? Any particular case that you really remember?
Well, there's a few watching on the screen. You know, there's there's a lot of patients like that. I can tell you there's one in particular from, I won't even tell you where they're from, but they came in and they're on my Instagram. Their stories on my Instagram, but they had, you know, they were like 20 in their late 20s. They had very asymmetric breasts. One was hanging down low. The other one was up high and very small. It was like an A and a D, CD. And you know, I have two daughters, and I just was like, gosh, this poor person has been through their life like this. And how I thought, you know, I just connect with this woman who's now a woman. I thought, gosh, this must have been hard all the way through adolescence and, you know, growing up and, you know, going to gym and going to all these different things. And so I just felt so terrible for her. And we did her surgery and we did it complimentary. And she just, you can see the uplifting spirit, the confidence level, and how happy. And I just wish I could have rewind that clock and done it when she was, you know, 13, 14 years old, because I know she had a lot of hardship. And, you know, sometimes those things can scar people for a long time. And, you know, that would have been a case I would have done at an earlier age for her. Usually I wait till age 18, but that one I think was, and it's on my Instagram. You can look at it there.
Yeah, no, I think we all would be now scrolling through your Instagram because there's a lot of stories. We all are doing it while you were talking. Amazing stories there of really common people also. Now, sometimes that we feel like the plastic surgery procedures like that are only for the celebrities or people that have to be, you know, more in the media, but it is also for common people to boost their confidence, as you said, because sometimes such things really help you to stand out in the world and be more confident with your physical appearance, because that does matter with your mental standards. So one question, last one from my side, and that is, what are the key factors that contribute to your successful surgical outcomes as a plastic surgeon? What generally are your few, I would say 3 key factors you keep in mind for the outcome that you are looking at aligning with the patient's desire?
Well, I'm definitely not an arrogant person at all, but I realize now that I was given kind of a gift to do what I do, and so I'm good at what I do. But not only that, I think that my communication skills are very good. I'm very honest with my patients, and before the procedure starts, they're going to get a clear and accurate picture of what is going to happen. I think honest communication is the currency of any relationship, whether it's, you know, with your spouse, your friend, business. So I want to have a relationship based on trust. That's 2. And number 3, you know, I think we just have a lot of great staff that have been with me for over 20 years that kind of make everything, you know, work out well for patients. So I would say it's those 3 things. You know, I'm very good at what I do and very honest with my patients, and my staff, you know, takes it from there. I think that's all helpful.
Communication is the key, as you rightly said. When both the parties are in alignment, I think it definitely helps, like the result for the result, because they, you know, both the parties are aligned for that outcome. And in order to, Dr. Fisher, are you having any plans in the near future to travel any country? Because our audiences are really like, which country are you going? And they would be, if they're near to that country, they would like to come there. Are there any plans currently?
I may come to the Middle East at the end of this year. I was there again last like 2 weeks ago. I was there for 2 weeks, and I'm thinking about coming again last quarter of the year.
Do you perform procedures there, or it's only for consultation?
Well, I have licenses there. I don't know. I've been looking around for a place to perform the surgeries, and you know, I don't know whether it's going to be in Abu Dhabi or Kuwait or Dubai or Saudi Arabia. I don't know. I haven't decided that yet.
Wonderful. I mean, we would love to, work with you because we have our partners in Dubai, Balouch Royal Investments. They are very well established for almost 25 plus years there. And we could definitely work with you to find a facility which is well equipped, modern, where you can, perform. And Dubai is quite a hub where the people from around UAE can travel, for the procedures. So we can always, work with that and look for it.
Thank
Sure.
you.
Thank you very much. I was listening, watching very carefully, and it appears that more than the technical questions, we had kind of a heart-to-heart conversation. And that's, I think, very important. I really want to express my gratitude to MediPocket and to Dr. Fisher, especially for being available for us. We look forward to having these sessions more frequently, as and when you are available. There are lots of opportunities in Dubai, as you would know. We have in Dubai now a strategy for medical tourism. So when you open the doors, you can go both ways, from UAE to US, and we can also have like top surgeons like yourself visiting UAE and having your patients treated here. I'm also son of a surgeon, so I really admire surgeons more than physicians, and it's really a great honor. And on behalf of Balouch Royal Investments, Microlink, all colleagues, I really want to express my gratitude, and we are looking forward to welcoming you in here in Dubai very soon. Thank you.
Thank you very much. I appreciate those kind words.
Everyone who is close to us is here today. So don't keep the word to yourself. You met Dr. Fisher. He's a celebrity. He's one of its kind professionals in plastic surgery and reconstructive surgery in US. You are looking at his website as well. Get to know him and don't keep the word to yourself. If you don't need it, somebody else might just need him, might just come back. And it's not only about the beauty, or it's not only about the appearances and looks. There is a lot to it. In some cases, there are like traumatic injuries where reconstructive surgeries are needed. In some cases, there are accidents or other sorts of problems. In some cases, effects of chemo require reconstructive surgeries. So look around, who to contact to. MediPocket is here. We are here in Dubai, and just don't keep the word to yourself. That's what I wanted to request.
I think the importance of second opinion of such things coming from medical fraternity itself, where doctors are encouraging you to go out and take advices from one to, even we heard from Dr. Fisher saying that same thing, that before getting into any major treatment or surgery, do talk to at least 3-4 doctors. And that is what the second opinion is about. Go to multiple doctors before you make that decision, then make a right decision. So
MediPocket USA - your trusted partner for simplified healthcare solutions.